Accessing Services, Conversations. This session provides information to assist you with the process of accessing services to meet your changing needs, to ensure that you have the support you need. Specifically, this session looks at the process of deciding to access services and gives some examples of conversations that might guide your own discussions. So when is it time to access services? It is always better to access services early, as soon as you think you might need them. For example, contacting home and community care and asking for an assessment relatively early can allow both person living with dementia and the caregiver to go through an assessment and get some early questions asked. That way, you can introduce services when needed and can then build on those experiences and contacts for more services as needed. As for who decides which services to use, that would be a decision for the person living with dementia and or their legally appointed decision maker. Over the years, both caregivers and people living with dementia have told us the following things that made it difficult as they considered taking the step of accessing services. You may relate to some of these. I don't know what's available and I'm too busy or too tired or both to even look. The person with dementia refuses help. I think I should be able to manage on my own. I dread the intrusion of strangers in my home. I don't want this to be happening. I feel guilty or sad. As with many aspects of the dementia journey, it is important to acknowledge the feelings that can get stirred up at this time. Many people feel sadness because needing help brings them face to face with the fact that this is a progressive disease and it is the very progression that has made services necessary. Others are very uncomfortable with the process of determining eligibility and the related questions that may seem intrusive. People have shared that they are uncomfortable with having strangers in their home. Their home has always been their sanctuary. Others have said that services that are available are not a great fit for their needs, and they feel frustration and anger that their particular needs have not been accommodated. Whatever emotions arise for you in this process, acknowledging the feelings and talking about them will help. This might be a good time to think about calling the First Link Dementia Helpline. It is a great resource to talk about the challenges that can arise in this process. Although the process of accessing services can be very difficult, there are a few strategies that may help. As much as possible, include the person living with dementia in the decision-making process while also recognizing that dementia impacts the ability to make an informed decision. The parts of the brain involved with logic and decision-making may be damaged by the disease, and emotions might be very close to the surface. Remembering that this is a disease of the brain and that both the person living with dementia and the caregiver are impacted by those changes can give you both space to approach these discussions with compassion. If it helps, emphasize that this is keeping people in the home and putting off going into long-term care. Reassure the person that you want the best for him or her and want to keep them safe. Ask him or her to accept the service for your sake. Acknowledge their underlying fears. Good caregiving sometimes means doing what a person needs, not necessarily what the person wants. We're going to look at some examples in the next few slides. It is always a good idea to start gradually with the discussions around service use. Think creatively about what might work. Persevere. One conversation may not be enough. Experiment with different phrases that might make sense to the person that you're caring for. For example, this is for me. I know you don't want help. This is prescribed by the doctor. This is a free service. This is my friend who needs work and can help us. This is only temporary. We'll look at some examples of how you can approach the topic of service use with somebody that you're caring for. For example, Leanne continues to live alone in her home after being diagnosed with Alzheimer's disease. She's able to do this with the support of her two daughters. Over the past month, they have noticed that Leanne has not been taking her medications. They have initiated conversation about having a person come in to help Leanne with her medications. At first, Leanne refused to consider this idea. They continued to speak to Leanne about having someone come in. It took more than one conversation, but over time, Leanne accepted the idea. And this is a phrase they may have used. I want to do the best for you. I will take care of you as long as I possibly can. I want you to be safe and well cared for, and that might mean letting someone else help us. I just want what is best for you. Karen's father lives with her and her family. He has always been an independent person. When Karen approached the topic of Jim staying at a respite hotel while she and her family went camping for a week, he refused and said, I can stay alone. She realized he was feeling worried that he would lose the independence that he still had and may not be able to return home. She appealed to his feelings and said, Dad, we know you've always been a strong person. This won't take away your independence, and when we return, you will come back home with us. It took a few more conversations, but eventually Jim did decide to try the respite hotel. Margie is her husband's care partner. She wants to support him to be at home for as long as possible, but is finding that with her own health issues, she is unable to keep up with all the household tasks and ensure her husband's well being is looked after. She knows that her husband would help if he could. She asked if he could help her by accepting help from someone else on her behalf. None of us wants to be a burden, and so this gives the person living with dementia an opportunity to be helpful to you and to someone else. Sharon's mom, Lillian, was diagnosed with dementia 5 years ago. She lives with Sharon and enjoys the support of her family. Lately, Lillian has been withdrawing from social and family life and is reluctant to go to her program. Sharon is concerned that Lillian is becoming socially isolated and is hoping her mom will return to her day program. She knows her mom wants to be useful to others and often feels that she might be a burden. Sharon appeals to her mom's sense of duty, and she may use a phrase like, everyone at the center is counting on you to go today. They need your help to get the work done. Be prepared to manage resistance on an ongoing basis. The person with dementia may no longer be able to understand why services are now needed. Acknowledge their feelings and underlying emotions. Be prepared to take several approaches over time. One strategy won't work for everyone, but be persistent. Start incrementally with services if possible. You can call the Dementia Helpline when you need assistance with useful strategies. You can contact us at the First Link Dementia Helpline. It operates Monday to Friday in English from 9 a.m. to 8 p.m. The number is 1-800-936-6033. It is available in Cantonese and Mandarin from 9 a.m. to 4 p.m. at 833-674-5007, and in Punjabi from 9 a.m. to 4 p.m. at 1-833-674-5003. And our website is www.alzheimerbc.org.